it was really important to me to be able to understand how chronic disease plays throughout the woman's lifespan. And so to have that tailored experience was really, really great.
Reasons why I was drawn to the pathway are that I was interested in women's health broadly speaking. In medical school, I was interested in, drawn to family medicine and gynecology, but ultimately the scope of practice of the internist. And so the pathway was kind of a happy marriage of my interests in women's health and also the spectrum of the scope of practice of an internist.
There's just such a higher volume of working with women, counseling about contraception, learning about menopause, talking about preconception counseling, the experiences that we get during our immersion months as well, being able to work with endocrinologists who deal with osteoporosis, OBGYN doctors who deal with more advanced stages of cervical cancer, breast health practitioners. There's just such a more varied experience that we get because of those months where the learning is really concentrated towards women's health. I want to stress that I think the curriculum within the women's health pathway is phenomenal. Those immersion months that we get where we have these academic sort of half days built into our schedules where we get to learn from other residents who have graduated from the program, other specialists in the women's healthcare field, and also primary care doctors. I think that's just a very unique opportunity to learn in a way that really pushes patient care forward later in our careers.
I think the attraction of a pathway is that, number one, it would allow me to get some procedural training because I really wanted to be able to place IUDs and Nexplanon and do endometrial biopsies, and I wasn't sure how I would be able to finish residency with that capability without some kind of more specialized training.
Really proficient at doing pap smears and birth control counseling, and we have done a handful of birth control methods in clinic, and I think that just having the support of people in-house, like in clinic, to help you do them just makes it so much easier to say to patients when they are asking about various different types of methods that, oh yeah, we can just do that here. And I think especially in women's health, sometimes knowing the provider doing something that is a little more personal and invasive can be a huge source of comfort for people. So I've had a lot of people really like the fact that either I can do it or I know very well the person that I can recommend doing it in the clinic. So it's been a really nice part of clinic.
As mentors, they also really help with scholarship, which is really important for all physicians, I think, but especially if you have any interest in academic medicine, it's really helpful to finish residency and feel comfortable writing abstracts and getting a chance to present at a meeting.
But because of that one-on-one individual mentorship, I think the pathway really functions as a leg up for any resident, no matter what their career path is.
The community in clinic has been an incredible surprise to me. I chose the pathway for the learning and for the skills development, but what I found was a group of women physicians who were my people. I just have a similar passion for our patients, have a similar approach to primary care, and that has just been a gift, I think, in my training as a resident.
I think what's kind of nice about it is that they are a range of experiences. So there are a couple of attendings who are within 5 years out of residency, but then there are also some who have a lot more experience, which I have found to be really nice to have mentors at different stages in their career and just have different insights and abilities to teach different things. So it's been great.
I think it was an incredible highlight on my CV when I was looking at jobs, and something that I talked about quite frequently in interviews for different positions. And I found that many of the docs that I talked to at clinics where I interviewed were really excited and interested that I had this specific interest.
And so because I've branded myself that way, my patients have frequently sought me out for that expertise, and in that way it sort of consolidates the care of my primary care patients under my umbrella, rather than having to, for example, refer out to a gynecologist, although it's nice to have that support as well.
It's a much smaller clinic, and so I think it's a more personalized setting where you really get to know the other clinic attendings and the MAs and even the front desk staff pretty well. And I think that is a huge plus, because in training, you are going from hospital to, like from Harborview to UW and the VA and inpatient to ICU, and then you get clinic thrown in there like once or twice a month. And I think it's really hard to gain that sense of camaraderie when your schedule is so chaotic.
I've had at least every, I don't know, 3 months or so, another resident will kind of find me or Nina and say like, oh, they had a med student who expressed interest in women's health but didn't know if they could do that in internal medicine, and we'll kind of feed them to us. And I love talking to them because I think it's really nice to share the knowledge that you can do it. I think a lot of people sometimes are driven away from internal medicine because they don't feel like women's health is easily integrated into that. I think that for any prospective resident interested in women's health, I think that UW is absolutely worth exploring. I feel like the mentorship that I've found here has been exceptional. I think that I feel like each of the attendings in clinic is incredibly open and welcoming of questions, and we all sit in this kind of small workroom together, and so it feels very much like a community, and it's very easy to ask and learn from patients that you see, which is really, really a special place. So it's